the other thing, of course, is we are studying how we can optimize the ability of Malaysians to use the entire health structure within our country, including the public and private. See, now there is a dichotomy that we have got a privatized scheme which is more or less borne by the public, the individuals, whereas the public sector government, which is more or less entirely subsidized by the government. So the group which probably uses the public sector hasn't got the ability to use the facilities in the private sector. So we have very high overloaded government facilities, sometimes less utilized private facilities. So we are thinking how we can bridge this. It's not an easy thing, but how we can actually create some initiatives to optimize the usage in both areas. Okay?
Universal access for Malaysians.
Well, that's a long-term solution. And whatever we evolved in the long term will be done with very extensive consultation with the public of Malaysia, so they should know what we are doing. But within that, we can also see other opportunities. For example, one area we are trying, although we have not done it because there are some cost implications, whether we can buy some services from the private sector, and then so where areas where it's overloaded in the public sector, we transfer it to the private sector, so they can see it, you know. So these are a few things, but this requires a willingness on both parties to cooperate.
It's a balancing act.
See, for example, we say, okay, patients with diabetes, hypertension, rather than then they need to be followed up in a government clinic. Can a GP's clinic do the same follow-up according to protocols and standards set by the Ministry of Health? And then if it's a person who cannot afford to pay and the ministry is willing to subsidize the care, but it should be something which the private sector is willing to do, at the same time be able to do it at a very affordable cost. So if we can, these are the type of balancing which we want to achieve, so that there can be optimal utilization of facilities within both areas.
Finance. There's always been the problem, the healthcare financing scheme. It's a dirty
There's no you see, because when people in many parts of the world, people contribute towards healthcare through some kind of insurance scheme or some, you see. But in Malaysia, so far we have evolved these two parallel systems. One is the public system, which evolved more or less free, and the other is a private system in which the patient pays entirely for everything. And it has worked, of course, so far. It has helped, because the person who can afford it provided good standard health care which satisfied them, and for those who can't afford, the government was there to take care of them. So, but as medical cost increases, for the government also is a big strain, you know, it's a big strain to be able to take on the cost of this whole thing. So that's the reason why we need to move forward towards a system which is more holistic. But there's no simple solution, because I think human nature is such, when you ask people to pay for something, there will always be resistance, but we have to take it step by step.
Message that the ministry would want to translate to have Malaysians see that it's a...
True. You see, Malaysia, sometimes convey. Last time, before even they had this, I think about this one care, before it was even discussed, there was already rumors in the market, you know, the government will charge them on this, that, this, and all these kind of rumors went around, and virtually paralyzed any form of discussions. So there will always be this reaction to anything new. So I think the best is to take it step by step, one by one, in which the people are part of the same, part of the program to do it.
Providing universal access, what step are you on?
Different things. One is we are seeing how even now the government can try to use some of the components of private healthcare within the present structure. which we are doing very in small amounts. For example, when we don't have radiotherapy facilities within the government, we are sending our patients to private sector. When we don't have scan facilities in certain areas where there's a private hospital, we are sending it to there. So in a very small scale we are doing it. But we can do it probably if the cost effectiveness is there, we can do it at a larger scale, right? Then the other one, of course, the universal funding system, we want to do a fairly good study before we can actually make any kind of proposal. The commencement of such studies is still at a very early stage.
Because you've just finished the public meetings with the public, I think late last year, they had that whole workshop.
They have done all that.
So
but this is the appointment of the people, a suitable consultant to do the study, that processes are going on.
So you're still collecting the data?
Yeah. We will monitor it as far as that concern on the drug concerns on the generics and all that. Our stand has been clear that our right to have generic medication at reasonable cost as what is now cannot be compromised by anything which is agreed through the TPPA, right? So that is as far as from the health point of view, So opening up the market and all that, we have got no qualms. Of course, there is this issue whether our local players will be able to withstand the competition by unrestricted flow. But I think in an open economy, sometimes we can't protect that for too long. So, but our main thing is there must be. There cannot be any obstacles to the availability of good medical care, good drugs, generic drugs available at a cheap rate.